In a dental setting, operatory preparation and disinfection are essential to providing safe patient care. Adequate hand hygiene, proper use of PPE, and thoroughly disinfecting environmental surfaces, devices, and equipment are among the most important facets of basic infection control. Upon entering the clinic and before preparing the operatory for patient care, hand hygiene must be performed. Hand hygiene is performed at one of the designate hand washing stations using soap and water. Ensure to follow the steps given on the hand hygiene poster located above the sinks. Hand hygiene is the most effective measure for preventing the transmission of pathogens and the most cost-effective. After performing hand hygiene, dry your hands using paper towel and then use the paper towel to turn off the tap. After performing hand hygiene, don gloves and begin the process of cleaning the high and low volume suction lines. Fill the clear plastic beaker to the 1,000 milliliter line and dispense 1 pump of Microvac or Nutravac into the water. Using this solution, start with the low volume suction and draw up half of the solution from the beaker. Return the suction line to the cradle and pick up the high volume suction line and draw up the remaining solution. This step is crucial as it removes biofilm that may have formed within the suction lines. Using the empty beaker, the dental unit water line will be flushed. Before the first patient of the day is seen, the lines, operator and assistant side air water syringe tips, and the high-speed tubing are to be run for 3 minutes. Pick up both air water syringe tips and expel water from the tips for 3 minutes into the clear plastic beaker. Next, pick up the high-speed line. Place the line into the beaker and using the flush switch located at the back of the unit, expel water from this line, again for 3 minutes. Once finished, rinse, dry, and disinfect the beaker using a moist CaviWipe. Between each patient, the same lines must be flushed for 30 seconds. Next, dispense 2 CaviWipes and perform a visual inspection of the cubicle. If you notice any blood, saliva, or other debris, be sure to clean this first before beginning to disinfect. Always ensure that the CaviWipe is moist. If not, discard and dispense a new wipe. Be sure to close the lid of the CaviWipe container after use. Once all visible debris or bioburden has been removed, discard the CaviWipe into the trash can. The cubicle is now clean and ready to be disinfected. Dispense a new CaviWipe and begin disinfecting the cubicle. Wipe from the cleanest surface to the most soiled surface to prevent cross-contamination. The following disinfection sequence is recommended. Ensure a fresh wipe is used when moving to a separate surface. Computer screen, keyboard, and mouse. Operator and assistant stools, including armrest, back, and seat areas. Bracket table and handles. Control unit surface, switches, and touchpad. Countertops, evacuation hoses, air water syringe, hanger arm, handpiece tubing, air water syringe, and hanger. Dental light and handles. Allow for 2 minutes contact time. This is the amount of time it takes for the disinfectant to work. After the cubicle has been disinfected, doff gloves and discard into the trash. Perform hand hygiene and make sure to follow the proper procedure. Refer to the hand hygiene signs posted above hand hygiene stations for the proper protocol. Alcohol-based hand rub is the preferred method of hand hygiene when hands are not visibly soiled. Now barriers will be placed on the dental unit. Using clean, ungloved hands, place the high and low volume suction tips and 2 air water syringe tips on the unit. Once all the tips have been securely placed, place a plastic sheath over the air water syringe, poking the tip through the end of the bag. The final barrier to be applied is the operator handle barrier. Once the patient is seated, inspect the exam tray for any rips, tears, moisture, or debris. If the package is compromised, get another tray. Next, unwrap the exam tray. Pull the tabs of the blue sterilization wrap to expose the exam tray. The sterilized blue wrap acts as a sterile barrier on the table. Now that the tray is unwrapped, don a pair of gloves and open the exam tray by turning the two knobs in the front and open the cover. Set the cover aside. Locate the sterilization chemical integrator within the tray and ensure the black line has passed into the accept or pass area. If there is no chemical integrator present or the black line has not passed into the accept or pass area, get another tray. When opening a steri peel pouch, perform a visual inspection for debris, rips, tears, or moisture. If the package has not been compromised, open the pouch from the base, making sure that the chemical integrator is present and has passed. During treatment, if a sterile item falls on the floor, do not pick it up until the procedure is finished. Ask for assistance for the retrieval of a sterile replacement. Be sure to perform hand hygiene and don a clean pair of gloves before resuming patient treatment. Once patient treatment is finished, doff gloves and your clinic jacket and perform hand hygiene. Walk the patient out to the waiting area. Upon returning to the cubicle, perform hand hygiene and don clean clinic jacket or disposable yellow gown. Carefully remove any blades and disposable sharps and place in the nearest sharps container. Remove the chemical integrator, cotton or gauze, and any other consumable items in the tray and place on the blue sterilization wrap. Place the lid back on the tray and secure by turning the knobs to the closed position. Ensure there are no sharps sticking out of the tray by checking all borders. If necessary, open the tray and reposition the instruments and close securely. Take the tray and any other reusable items to be reprocessed to the soiled instrument cart. Place inside the gray bin located on the top of the cart. Open the tray and spray pre-cleanse evenly over all soiled instruments. This will pre-clean the instruments and prevent the formation of biofilm. Once sprayed, securely place the lid back on the tray and ensure instruments are not sticking out of the borders of the tray. Place the tray inside the soiled instrument cart in an orderly fashion. Remove gloves and perform hand hygiene. Once hand hygiene has been performed, don a new pair of gloves and proceed with cleaning the cubicle. Start by removing all barriers and suction tips and place on the blue wrap. Gather any remaining single-use items and place on the blue wrap. Bundle your items with the blue wrap and discard into the trash. Once the bundle has been disposed of, doff your gloves and perform hand hygiene. Don a new pair of gloves. Now you can proceed to clean and disinfect the operatory as you did in the initial setup. At the end of each appointment, all suction lines are cleaned using the same method as before, with a solution of Nutravac or Microvac and water. Once cubicle disinfection is complete, with gloved hands, remove the garbage bag and tie off. Replacement bags are located at the bottom of the trash can. Place a new garbage bag in the trash can and take the tied off cubicle garbage bag to the main clinic trash. Doff gloves. Proceed to the designate hand washing station and perform hand hygiene. Be sure to follow the proper hand washing steps. Don clean gloves and dispense an approved disinfectant wipe for glass and plastic. Remove protective eyewear and face shield if worn, and clean and disinfect items with wipe. Store eyewear and face shield as appropriate. Remove lab coat and place into the soiled linen bag or discard disposable gown. Perform hand hygiene.